Well, a 20-year-old South Jordan man is the first patient in Utah to receive a new type of defibrillator. He's been battling a heart condition and qualified to have that procedure on Tuesday.
He's now out of the hospital and is recovering. He and his doctor are talking now about the life-saving surgery.
Our Christine McCarthy covering the story. And Christine, the new defibrillator, it doesn't touch the heart, right? So how does it work?
Right, it doesn't. It's under the skin and it's on the left side of the chest. It uses sensors rather than the electrodes and the wires that actually touch the heart with standard defibrillators. Now, those standard defibrillators, doctors do tell us, don't worry, those are still effective. They do a good job, but this new device reduces the risk of infection or breakage.
I just want you to relax. Nervous. A lot of pacing.
Lisa England's son Brandon went into surgery at Intermountain Medical Center Tuesday.
Even though it's so safe, you know, it's still your child being cut into.
To have a defibrillator implanted in him as he battles a dilated cardiomyopathy, a weakened heart struggling to pump blood.
He was like a completely different person. Really, he even just about gave up his will to live.
Cardiologist Jeffrey Osborne explains Brandon's life-saving device.
If they have a spontaneous arrhythmia or a fast heartbeat that used to kill these patients off, it will shock them back to life.
But this is a new kind of defibrillator, the first to be used in Utah. It's placed under his skin without electrodes or wires in his heart.
This new innovation allows us to avoid having leads touching the heart that can, unfortunately, those leads can crack and have complications develop in it.
Surgery is a success, and Brandon goes home the next day.
Big relief lifted off my shoulders.
He's now sore but at ease.
It's like an airbag in a car. It's there if it needed. If I have a deadly heart rhythm, it's there to save my life.
He hopes his case will help future patients.
It just gives the doctors and nurses and whoever else needs it later in the future a great stepping stone.
And Dr. Osborne is ready for more procedures.
Oh, it's an honor. I think this is going to be around, and it's going to definitely play a bigger role in the future.
Brandon returns to school next week, a relief for his proud mother.
I think that he has his whole life ahead of him now where he can do whatever he can dream up, and that's just wonderful.
And this procedure has been done in other parts of the country and the world, but again, this is Utah's very first, so some exciting stuff. Now, as for Brandon, he plans on becoming a diesel mechanic. He's in classes for that. He's going to be back in class just next week. This was about an hour and a half or to a 2-hour procedure, so this really didn't take very long. He was out the next day, back sleeping in his own bed the next night, so he's doing very well. His mom very happy about that. That battery will probably last him about 6 or 7 years. The actual device could last about 20, but by that time there could be a newer, lighter, better device out at that time. Back to you guys.
What a success story. So glad he's doing so well, Christine.
Yeah, and a young guy, 20 years old, so this is just awesome
Whole life
stuff.
ahead of him. All right. Thanks so much.